So Medicare, it's a little bit of a wayback machine. We were founded by Dr. Ethel Percy Andrus, who was a retired superintendent of schools, and at that time, it was before Medicare. And at that time, retired teachers had no health insurance. And she thought that was an outrage. And she knew that by engaging in what she turned out to be a great model of advocacy, she saw the opportunity to combine providing the insurance coverage for teachers, but also providing a social mission in the nonprofit world. And so effectively, for all of these years, we have had a social mission focus on advocacy and delivering programs in community.
Welcome to Cambridge Forum, coming to you live from Cambridge Public Library. This is our first hybrid event, linking up live with our audience on Zoom. So greetings to everybody. I'm Mary Stack, the Executive Director, and today we're pleased to concentrate on a vitally important but often misunderstood topic, Medicare. Last week, we devoted a whole program to examining the pros and cons of retirement, and today we're focusing on Medicare. We've got two great guests to help us in our task, and they are Mike Festa, the State Director for AARP, and Maureen Harty, social worker and Shine counsellor who works with Paine Senior Services. Following their presentations, we'll open up the floor to questions and also take questions from our Zoom audience too. So first, I'm going to start by introducing Mike Festa, who's the AARP State Director based in Boston, serving 800,000 members in the Commonwealth. Since joining in 2013, Festa has been fighting to lower prescription drug costs, support family caregivers, and make it easier for workers to save for retirement. So Mike's going to tell us a bit about AARP, its function, give us a brief history of Medicare, tell us why it's so important, and then Mike will hand over to Maureen.
Very good. Well, thank you, Mary, and thank you to Cambridge Forum. It's an honor for me to be here representing AARP Massachusetts. And I'm going to spend a little less than 10 minutes, but about that amount of time to give you an overview. Now, I think everybody who's listening, whether you're in the live audience or on Zoom, you're here because this is an important subject for you. And I want to assure you that at AARP, fundamentally, we consider this to be an absolutely essential program that we've been fighting for ever since it started under the Johnson administration, so it's been quite a while. We obviously are very concerned with the other critical senior-related benefit, and that's Social Security. So in the area of what we do as an organization, I think it's important to clarify, I'm here to speak to the work that we do to further our social mission, which is to support people 50 plus in the community in a full spectrum of whatever they're dealing with. You know, we do a lot of advocacy around caregivers, a lot of work both at the federal and state level to ensure that there are government policies that are fair and protect the interests of the older population. And when it comes to Medicare, I think it's important to acknowledge that as we speak today, the financial condition of the program is strong, but it is vulnerable. And it is inherently vulnerable because we know, certainly in Massachusetts, it's quite evident, and this is probably true in most parts of the country, the costs of health care are extraordinary. And they are increasing, not exponentially, but suffice to say, in ways that put a lot of pressure on the government's ability to fund that through, say, a Medicare program, but also, as we all know, the implications to individuals in being able to afford health care. So Medicare, it's a little bit of a wayback machine. We were founded by Dr. Ethel Percy Andrus, who was a retired superintendent of schools, and at that time, it was before Medicare. And at that time, retired teachers had no health insurance. And she thought that was an outrage. And she knew that by engaging in what she turned out to be a great model of advocacy, she saw the opportunity to combine providing the insurance coverage for teachers, but also providing a social mission in the nonprofit world. And so effectively, for all of these years, we have had a social mission focus on advocacy and delivering programs in community, programs that support caregivers, fight fraud. That's another big thing that's always on our minds. We're concerned about that. We're doing a lot of programs around, preparing for retirement, demystifying Social Security, and of course, on the subject at hand, which is Medicare. So that fundamental acknowledgement, I think, that Medicare is really the path for health insurance coverage for the vast majority of folks 65 plus. Now, some of you, if you've already done a little bit of the research, you know that you're not forced to take Medicare at 65 under certain rather narrow circumstances. And I think that our expert from the Shine Council may indeed take that question, and I'm happy to too. But I just want to acknowledge that there are elements of this program that can be very complicated right off the get-go. And so you don't want to think about this subject without doing fundamental research. And that's the second point I want to make, that at AARP, we take our education and outreach very seriously as much as we do our advocacy. And so, outside in the foyer, folks on Zoom can't see this, but we have a nice, 6-page, pretty much what's Medicare all about? How do you apply for it? What are the issues? What are the details? And for the audience on Zoom, I would just say to you that if you go on aarp.org/MA and type in Medicare, you'll be able to get, and there are other references that you can get, that additional information, which I'm only going to gloss over. But I want to also talk about something that, it's arguably a little sharper subject, and that is the challenge that we faced as an organization. And it's been a fight that took many, many years to win. And I'm happy to say we just won it. As I suspect most of you in this room are well aware, there was a long period of time when the government was prohibited under Medicare to negotiate prices for drugs with pharmaceutical companies. It was an affirmative prohibition within the federal law. And we fought very, very hard for over a number of years. And finally, with a 50 vote plus a vice president, we got that change. And so as I speak today, in the fall of 2022, we're in a situation where coming up in the next several years, there's going to be an opportunity for the government. And we're talking about millions and millions of our recipients, or those who are receiving, who are under the Medicare program, being able to effectively use those quantities as leverage with pharmaceutical companies to ensure that the pricing is fair to the government as they reimburse. And generally, the implications are that that will inure to the benefit of individuals, because competitive forces, as we know, certainly in a capitalist society as we have, should create opportunity for reduced prices. And that lack of negotiation, that lack of competitiveness, has created part of the problem we have right now. So there has been a solution proffered and enacted. It is not complete. I mean, there are too many of those drugs. There's only 10 in the first formulary, in the first opportunity to negotiate, but it will get better over time. And that, in coupled with the insulin price, as we know, the insulin cap has gone from, the cost is expected to go from $300 a month down to about $35. So real progress affecting people's, frankly, in the first instance, their ability to live a quality of life or even avoid dying. Many of these pills and these medications are fundamental to living well. And we've always taken the position, quite candidly, that we respect, I want to make this very clear, certainly in this environment where I'm speaking in Cambridge, we've got a lot of great biomedical firms. We have a lot of great pharmaceutical companies. They are not the enemy per se. We need them to continue to do the kind of great research they're doing. But in the way we conducted ourselves, I'm sorry, I keep hitting this microphone. The way we've conducted ourselves politically with a small p, keep in mind, we are nonpartisan. We don't give money to candidates. We don't even endorse candidates. But what we did in this campaign is we frankly called out Big Pharma, and recognizing the fact that they were spending a lot more money on advertising than they do for research. They're using their preeminent position in the marketplace and the effectively lack of negotiation to really jam it to us, quite frankly. And you look around the country, I should say around the world, and I think it's quite evident to this crowd that we as American citizens were essentially subsidizing a lot of other folks around the world. And so we're trying to right that ship. But that is in essence what AARP was doing in trying to create a better level playing field. And I would tell you when I spoke, alluded to the fact that Medicare as a funding source for the payment of health care is in jeopardy. It's simply true that unlike Social Security, which has a longer expectancy of solvency, into 10, 12 years, I believe at this point, Medicare, it's a budgetary matter. It is, it's fraught with challenges in the immediate future. And so part of what AARP is doing is advocating in the Congress, in the administration, and to the extent that there are some, aspects of this that are state-based policies, we're there to represent the interests of the 50-plus folks and all folks who have the need for medication. So I wanted to let you know those things, understanding that that's really not the primary reason for this forum. We want to focus on those of you who are interested in learning about the Medicare program to the extent that you have some questions. We're going to obviously respond to those. But in the end, the reason why AARP is here is because we want to underscore the fact that there are two parts of this. Number one is making sure the laws protect those who rely on these kinds of programs, and that's what our advocacy is about. And number two, it's our education and outreach, and that's why I'm here, honored to represent AARP, to hopefully provide answers to the questions that are on your mind. And with that, I've sort of self-timed myself, Maureen. I hope you're ready. I am going to introduce Maureen Harty, who is really a professional. I want you to know something. When we speak of the SHINE program, SHINE volunteers do God's work. They train on all of the detail. They are really good at what they do, and they are volunteers. And the fact that we have all across this state SHINE counselors that are part of the home care programs, the network around the state. For those who are listening and are curious, obviously Maureen's going to address some of this, but we know that in the end, it's a conversation that needs to be more intimate with you, a SHINE counselor, and whomever else you may need to rely on additional information. So with that, it's my honor and pleasure to introduce Maureen Harty.
I'm just going to say a quick word about who she is.
Oh, yes, and that too. Back to you, Mary.
Thank you. Okay, I would like to introduce Maureen Harty. She's a social worker. She's also a SHINE counselor with Paine Senior Services. She received her MSW from BU School of Social Work in 2000. And now she works for Paine Senior Services, which is committed to providing a wide range of quality, personalized services to Cambridge elders and their families, regardless of financial means. So they do a lot of really good work. In the spirit of compassion and justice, assistance is offered through counseling, preventative planning, advocacy, and collaboration with community resources. I printed up a handout for you to take away, and it has lots of helpful contact information, including Maureen's phone number and her email. So you really can get personalized help. Can't get better than that. Okay, it's my pleasure to introduce Maureen.
Good evening, everybody. Thank you for that lovely introduction. I had to put my glasses on. Just to tell you a little bit more about Paine Senior Services, we do serve Cambridge residents specifically over the age of 60, and we help their family members and caregivers navigate the health system.
I can't hear you.
Oh, Can you hear me now? Okay, sorry about that. Yes. So, yeah, Paine Senior Services serves Cambridge residents over the age of 60, and we also help their family members and caregivers navigate the healthcare system. However, if you don't live in Cambridge, you can still call us, and we will certainly help you find help that is local to you. Please go to our website at painesenior.org. That information is on the handout. Actually, yep, great, thanks. So this presentation is actually an abbreviated form of what you would see at your Council on Aging. At this point, it's kind of late in open enrollment, so they probably have already had their presentations, but I would encourage you to look at the website of your local Council on Aging. Sometimes they have Medicare Basics with a Shine Counselor, and then they'll usually have a Medicare update closer to the beginning of open enrollment. Okay, let's see. All right. So as many of you know, the Medicare is pretty complex. So we have the handout to sort of summarize the big changes this year. So I'm not going to get into the details, but certainly if you have any questions about those details, certainly during the question and answer period, I'd be more than happy to answer your questions about that. I don't know if I keep switching this by accident. So the SHINE program is provided by Massachusetts Medicare beneficiaries with access to accurate, unbiased health insurance information, counseling and assistance at no cost through a network of state-certified health benefit counselors, and that's basically all the kind people who support us. SHINE program is administered by the Massachusetts Executive Office of Elder Affairs, and every county has a regional office. Our regional office is out of Minuteman Senior Services in Bedford, Mass. So basically, they take care of all the training, and we meet monthly out of that county SHINE regional program to get updated on all the changes of Medicare and some Medicaid. Let's see, so if you want to find a SHINE counselor in your area, you should call 1-800-AGE-INFO. That's 1-800-243-4636. That should also be in your printout. And option 4 will direct you to a counselor that in your county. And let's see, and so in preparation for your meeting with a SHINE counselor, it would definitely be helpful for you to let them know if you have a retiree health plan, an employer plan, VA coverage. So there's all sorts of other coverage that's kind of beyond our scope, but we can certainly talk to you about, because some people think, well, maybe I'll get a better deal somewhere else. And my experience is that normally that's not the case, but occasionally we have run into situations where it would be better for the person to just enter the regular Medicare marketplace. But again, it's changeable. If you have something through an employer, it's probably better to stay with them, but we'll tell you what's out there for Medicare. The SHINE counselors pretty much just sit down with you and talk about your personal situation. So that sort of drives the conversation and our recommendations. Normally the question I'm most often asked is, what's the best plan? There's really only the best plan for you right now, because your health changes, your resources may change, your priorities change. So having a one-on-one discussion about that, we can narrow down your options and then help coach you to write down some questions so when you do call the plans, you know specifically what your priorities are and what you're asking for. Because when you call the plan, they're there to sell you their plan. So they'll sell you the best plan for you under their company. But is that the best plan for you? It depends. And things are changeable in your situation. And so I sometimes get calls mid-year, somebody's situation has changed drastically. We sort of problem solve around a new medication that's not covered, You know, if there's any other broad changes that need to be made. Sometimes changes cannot be made, but, you know, we have a few strategies for dealing with things that come out of the blue. Okay. So what is Medicare open enrollment? So it does happen every year between October 15th and December 7th. And remember, you're just making a choice for the following year. The coverage starts January 1st. So you're basically anticipating what your needs may be in the following year. If you and your doctor are working up, you know, a certain medical issue, and you're talking about what-if scenarios, that may influence what choices you make for 2023 in this case. The reasons why you would consider looking at your coverage, it's all up there. Your prescription costs may have increased. You may be traveling more, and perhaps your Medicare Advantage plan is not covering you out of area. Upcoming surgery, you may be overpaying for coverage. You have a new diagnosis. You have a change in resources and living expenses. Your doctor may have been dropped by the plan. Your employer may be changing the retiree health plan. So, all right, online Medicare account. So that would be the next slide. Okay, so the main tool we use to research plans is the plan finder on Medicare.gov. You used to be able to go on Medicare.gov and save your medication list under a number and a date password. So you didn't have to create an account. Unfortunately, they don't let you do that anymore. If somebody has 1 or 2 medications, you know, I'll manually do a list. You can still do that. But if you have a very long, complicated list and you want to take medications off or change pharmacy, go back and forth, it becomes a bit unwieldy. So I do encourage you to set up access online to create an account. You don't have to have an email to create an online account. You just have to have access to a tablet or a computer, or a family member could help you create access. And you would create a username, password, and answer a security questions, and then you'd be able to have access to all your Medicare information. You could print out a new Medicare card if you lose yours. You can compare plans and figure out what the best option is for you. So I'll usually help people set up that Medicare.gov account if they need help with that. And I'll create a report, and I don't print out the whole report because there's a lot of confusing information on it, so I just try to keep it simple to the premium, deductible, and then the grid that shows you at what point in the year you're paying a certain copay. So that's the Medicare.gov. Yes, so the 2 coverage options. This causes a lot of confusion with people. So you basically have 2 approaches to Medicare coverage. One is what I call the a la carte method. So you have original Medicare A and B and a Part D plan at minimum, a prescription drug plan. But with Medicare, there are deductibles and co-insurance of 20% because they cover 80%. So you usually need something to supplement. These I'll call Medigap plans. It gets kind of confusing because people refer to Medicare Advantage plans and Medigap plans as Medicare supplements. And so it gets very confusing when we talk about them. So I'm going to refer to them as Medigap plans because they cover the gaps in Medicare. And there are 2 to 3 options for Medicare supplements, Medigap. And if you were born, if you turn 65 before 2020, then you have 3 options. But after 2020, you only have 2. So there's Core, which doesn't cover the deductibles of original Medicare. And there's Supplement 1A, which you only are responsible for the Part B deductible of, I think it's $266 this year. And then Supplement 1 is everything is covered. Medicare pays first, the Medigap follows. So then you're pretty much just paying the premium. So that has a lot of flexibility because Medicare does not have a network of providers. However, Medicare is kind of pretty bare bones. So they don't have eyeglass coverage or hearing aids or dental. Some of the Medigap plans do have some of those coverage pieces, but you'd have to look at the details, to see if they're really going to serve your purpose. Now, the other one is the Medicare Advantage plans. These are the managed care plans, the HMOs and PPOs. So there are a network of providers. For HMOs, you have to stay in network, or your doctor would have to refer you out of network. They cover your prescription drugs, so it's all under one roof. They will have some eyeglass benefit, maybe have minimal dental benefit, some hearing aid benefit. So it's, it can be a good option for people, who want a more affordable way to cover their costs. They're not seeing the doctor all the time. That's not to say that there aren't some Medicare Advantage plans that people who have challenges, it meets their needs. Again, it depends on the details. But some of the folks that I work with, they get very overwhelmed by the idea of figuring out who's in network, who's out of network. I don't want to be worried when I'm sick about whether a bill's going to be covered or not. If there's a family member that can help you do the research and make it less overwhelming, that certainly is ideal. Some of the people that I work with, I get concerned if they can navigate a Medicare Advantage plan. So this is a part of the conversation about what makes sense for anybody in any given moment. Normally with the Medicare Advantage plans, there are multiple plans, per company. The lower the premium, the higher the copay. So if you're a healthy 67-year-old who sees your doctor like maybe once a year, it'd be fine to go into a zero premium plan, get your drugs covered, if you have any medications, and it's a good fit for you. As things change, you may need to reconsider, what's a good option for you.
I was told you can't go back to regular Medicare if you go with an Advantage.
That's not true.
That's not
No.
true.
You can't, we'll talk about that. We'll talk about enrollment periods. Okay, so where to go for help. So these are Minuteman Senior Services. That's the regional office. This is a great resource, the pharmacy outreach, because they have pharmacists. So if you're having a hard time getting a medication covered, they may be able to propose an alternative medication you can talk to your doctor about. Of course, the Social Security Administration is the one that's involved in the enrollment of Medicare. And they'll also talk to you about what your Medicare premiums will be. And Prescription Advantage is a wonderful program. It's a state pharmacy assistance program. So it's specific to the state of Massachusetts. It supplements your prescription drug coverage. And the greatest benefit to it is that it gives you one special enrollment period during the benefit year. So if you choose a plan that's not working for you and you qualify, because they don't count assets, they just count income, and they have a pretty broad range of income for the criteria. So I would check out their website, prescriptionadvantagema.org, to see if you qualify, because you don't normally have to pay anything for it. If you're in the highest tier, you possibly could, but if you're, S1, S0 to S4, you wouldn't. And it's a great benefit. It will cap your copays in the coverage gap if you have really expensive meds. So it's a really great program to explore. And that's it.
Well, we've got questions, I'm sure, on the floor. We've also got questions that have come in from Zoom. So has anyone got a burning question straight away? We do. Okay, so Liz is going to bring you the mic.
I think this might be for you, Mike. You were talking about your advocacy that you do in Washington. Well, certain politicians keep saying they're going to take money out of Medicare and they're going to take money out of Social Security. Isn't that our money that we've been putting in to these funds as we worked? FICA and all that?
Well, with respect to, let's first of all clarify, with Social Security, as we all know, when you're working, you're paying in, so that's your money, and that's certainly the issue. of how one affects the Social Security trust fund and the long-term solvency. Again, we watch that carefully. The conditions on the ground right now, I would not want anyone listening to worry that Social Security is in jeopardy of running out of money. When it comes to Medicare, this is a budget item that's part of the federal budget. It's not something you're paying into it. I mean, every time you get your paycheck, look at a list of all those deductions, and they include Medicare. And obviously, you're paying a portion, you know, for the premiums, right? I mean, after you're enrolled. I'm on Medicare, by the way, and I'm going to tell you, I may be the state director of AARP, and I want you to know, former Secretary of Elder Affairs. That took me a long time to go through it. It's not easy. We must recognize that this is probably the most important thing you're going to do, you know, arguably equal to Social Security, you know, when to take it and all of the implications of that. So you really, I mean, the message here is clear. Do not do this on a frolic. Do not do it without adequate research. Do not do it without consulting with a Shine counselor, with all other kinds of resources. And by the way, I'm holding this because I have to show you the prop. Medicare Made Easy, which I think is a title that is an oxymoron, but that's okay. That's AARP's publication. We care, and there's a lot of detail in this. And so if you are watching this on Zoom, all you need to do is go to aarp.org/MME, and you'll get all this information. Just for those of you in the room, if you've grabbed it, you can just see that there's a lot of information. So that's a long answer to the question. I want you to know, however, that AARP considers the Medicare solvency question to be, you know, a really serious conversation with our elected officials, because part of it is, you know, you got to follow the ball. This is very complicated legislative stuff. Even for those of us who have done it for many, many years, we have a whole group of folks in our government affairs. But when there was negotiation around the Medicare negotiating, Big Pharma, you know, that whole issue about drug prices, there were all kinds of amendments, all kinds of strategies, and it became, you know, a really complicated situation really quickly. And when the dust is settled, we are a lot better off than before the law was changed. But I would tell you that it wouldn't shock me that in the next Congress, I mean, the Congress is split. So let's be candid. It's going to be very hard for one party that might want to cut Medicare benefits, might want to change things that they've been talking about. You need to get through a Senate, and you need to get through a president to make that law, and that's not real, certainly for the next 2 years.
Great.
Thank you. Sorry it took so long, but I want to, yeah.
When you started your presentation, you mentioned handouts, and you mentioned a number we could call for a Shine counselor in our area. Maybe I came in late, I don't know.
Yes, it's outside. They're outside. You can get one on your way out.
I see.
We're happy to give you one.
Yeah, all the information's there.
Right.
Because I've been trying to link up with the Shine counselor in Cambridge here. I've not been able to.
You know, it's very hard because, you know, December 7th, the end date, and Shine counselors get booked pretty quickly. But you're a Cambridge resident, correct? Right. You email me, sir, and I will get in there.
I have the phone number to use to find out.
Yes.
You'll get it. Trust me,
It's
outside in the handout. Her phone number and her email.
Yeah, my phone number is there, and just, you know, leave me a message and remind me. What's your name, sir? Louis. Yeah, you leave your name and I'll remember you, and I'll, you know, nothing's booked up yet, so I will make sure, because the Council on Aging does get booked up very quickly, and Somerville, Cambridge Elder Services, Shine counselors tend to focus mainly on their current clients. So I'm in the basement Waiting. I'm so lonely. Please call me.
Wow.
It's just, I'm just waiting to help somebody with insurance. And, you know, I'm going to take new referrals. I don't take them up to December 7th because things get complicated and I need time to research. But so next week will be the last week I'll be taking new people because some of my old people kind of call back. But you call me and leave a message and I will call you back and we'll set up a time, okay?
Okay, I hate to rush you, but we've got people lining up on Zoom from the producer. We'll take your question.
Okay, I'll talk very quickly. Mike,
Yes.
thank you for coming, all of you. We talk so often about how complex these programs are, and I can only imagine the amount of administration at Medicare that needs to subsidize all this and help out. Is there some mechanism at AARP where you talk directly to Medicare or the government about, like, putting the person who came up with the donut hole in front of a firing squad?
We wouldn't resort to that kind of advocacy, but I get your point. You know, look, one of the takeaways from this forum, I hope, that you get is to acknowledge, number one, it is complex. You do need resources and support, but there are a lot of resources and support out there. And so even Medicare government agency that's, you know, doing the administration of this, they have plenty of information. The challenge is, if you go on the website and you call and you wait to talk to someone, I did that, by the way, it's a challenge. Now, as far as the bureaucracy, you know, look, we understand. Hey, there's something else I want to say. Legislators, your state senator, your state rep, your congressperson, I'm a former state rep myself. I have to tell you, constituent calls of this nature are really not only welcomed, but they're the kind of thing that you are equipped well to do. Because if Joe somebody calls Medicare, that's one thing. If Congressman McGovern calls Medicare, you know, or one of the staff, you know, it's just the nature of the beast, right? So don't be reluctant to contact your elected officials to ask them to help you through any of the barriers that are out there, and they are real. But I don't know if that answers your question, but honestly, what?
Just, is there work being done to simplify it, I guess was my question, because everyone's been talking about how complex it is for years. Does it need to be that way, I guess?
I think the complexity of it reflects the healthcare system in this country. There is so, I mean, even if you solve Medicare by having a one-page application, think about all of the healthcare providers that are paid through Medicare. Think of the system we have set up just in this state, how many private insurance carriers there are. You know, it's layers and layers of complexity, which do have, I think, even with Medicare solving the bureaucracy problem, they do have those barriers still that you've got to break through. But again, you're not alone. I mean, people are paid to do this. Some volunteers are doing this, but they want to help, and you should, you know, reach out for that help.
Okay,
Yeah, question from the audience, the virtual audience. So there are two. The first one is at what time, when is it, so let me find it again, when is a good time to meet with a child counselor? And the second one is it ever wise to seek better coverage and one that the former employer has generously sponsored?
So, you know, you
so
can...
first of all, we should reiterate the
All right,
question
sorry.
since that's not being recorded.
Okay.
Okay. So when is the good time to seek advice
Yes.
for changing your Medicare program? That's why we're having this program.
Well, well, first of all, initial enrollment, when you first become eligible for Medicare, and then open enrollment, which happens every year between October 15th and December 7th, because that's when we become aware of the changes and we can, you know, we have the information for the following year. Now, with an employer coverage, as I said, my experience has been, because employers can negotiate, like sometimes they'll have hybrid Medigap plans that have drug coverage. You don't see that out in the world. And that's a lot of savings. So it's hard when people come to me because I can't do a one-to-one comparison. I can tell them what's out there for Medicare, They are often shocked and go back to their retiree health plan. But there are other people who are like, they're in a divorce, they negotiated for their spouse to continue, their spouse is continuing to work, but due to the strained relationship, they don't know if they're ever going to be dropped, or, you know, they feel vulnerable. So they want to see what so there's all sorts of life situations where someone, you know, it doesn't hurt to call a Shine counselor to say, this is happening, I don't know if what my options are. You know, it's free, it's a phone call. You know, I would always say whenever you have a question.
If I could just follow up briefly,
Yeah.
Maureen, on this. First of all, in terms of original enrollment, right? So you've got that 7 months. You get 3 months before you turn 65, the month you are 65, and then 3 months after. That window of 7 months is when you have to act, okay? The other thing I want to tell you, and this is not getting too deep into the weeds, but I'll use myself as an example. I have, when I used to be in state government, I have state-based employer coverage. Their arrangement was, and still is, that if once I turned 65, I had no choice. They would no longer cover me as a state employee. I was forced to get the full Medicare coverage, but I kept the, you know, the supplement, if you will. Effectively, I'm still paying a state premium, you know, for that other coverage to sort of fill the gaps. But you may find yourself in a situation, we talk about that exception, you know, you really should think of it this way. Most people, I mean, the vast majority of people, when they turn 65, they should enroll in Medicare. And if when you get into the weeds and when you're talking to Shine Counsel and they say, so where do you work now and how's the coverage? Let's find out. Maybe they'll cover you and the cost associated generally is less. The premiums are less if you're still on your, you know, your employer coverage. So it's, it gets a little sticky pretty quickly, but those dates, that time when you turn 65, it's a magic number. And a lot of people are, you know, these days, I have to say, a lot of our members, you know, you hear about it all the time. You're 62 and you're just clinging, hanging on, waiting to turn 65 so you can finally get Medicare coverage.
6 and 4 months.
Well, you know, but suffice to say, there are challenges with both Social Security qualifying. You know, the date is pushed off a little more.
So just before I take
Yeah.
the next question, one good point that Maureen emphasized is when you do come, if you make an appointment with a counselor, make sure you're completely in control or having access to all your information, the current information you have, your current health insurance, your provider, your list of drugs, so that when you have this consultation, she's then able to give you the proper advice because she's equipped with all the information, particular to you. And the second thing is that this change that you do at this period till December 7th is just for the coming year. Right. So don't worry that it's carved in stone, it's irrevocable, you've made the wrong decision. You know, people's health and their conditions change all the time. So you can renegotiate it this time next year. You can reappraise it and change it.
If you don't change, do you get, like I'm already in Medicare.
Mm-hmm.
If I don't change anything, do I stay with what I have?
You do, unless you're in one of those plans and they're listed in the handout that you're being crosswalked over to another Part D plan. Yeah, but I would double check that because the thing, especially with Part D plans, companies come and go, they merge, they change their structure. So people think, oh, well, I'm happy with this plan, it will always be the same. It's not. And so you always have to recheck and make sure that they're still covering you, because what I've seen happen, because I've been doing this since 2006 when Medicare Part D first came in, a low-priced Part D plan will come in, everybody will enroll in it, and then they up things because they're counting on you not checking it. Maybe, I'm assuming, but they know people don't want change, and they think, oh, well, and people will call me, oh, well, I enrolled in this in 2006, it was great then. I'm like, it may be a totally different company now, but it's like, you know, so again, check every year, it doesn't hurt, I don't mind looking. Yeah, I'm at my computer doing searches, again, call me.
Just remember, she's lonely, she
I
needs more people.
I need meaning in
Come
my
visit.
life.
Change the locks on the door.
All right,
Maureen.
Maureen,
We've got a question back there. While you're taking the mic back there, Liz, a question came in on Zoom. I recently sold my house in California, moved to Massachusetts, put 90% of the money into a new home. Why did Medicare go up?
So, and maybe you can help me with this because I forget all the initials and what they stand for, but basically when you retire, of course, it's, most people, their income's going to change. And so they're basing your Medicare premium on the previous 2 tax years. But you can meet with Social Security and say, well, this is going to be my new income. But when you have a one lump sum amount, it's for the year, correct? It's an adjusted.
Oh my God, this is something. Again, I think the reason why they picked me is because I'm an example of how not to do things. So here's another example of that. I actually, I decided to cash in part of my 401k because I wanted to acquire something. That was treated as ordinary income. I'm thinking, okay, there's no penalty because I'm over that age, but I'm going to pay my tax, as ordinary income. What I didn't realize is that put me to the next bracket of Medicare premium costs, which doubled my costs per month for the entire 12 months. I'm an idiot, and I confess that to you publicly. But I'm going to tell you, I called Medicare. I did make that phone call, waited 2 hours, but I got a very nice person who said, oh, we're really sorry about that, but you know what? I said, well, this is just a one-time. If you look at my income for the last 2 years, no, sorry, we'll get that adjustment. Now, this call I made, I think in January, they said, well, we're going to adjust it again in November, and I said, well, that's great, So I paid the higher premium for an entire year. So be careful. This is where, if you don't have to have a financial planner as such, but ask the question, look at the schedule of the premiums. Where is your income now?
Yeah.
If you have a lump sum payment, see if it's insurance related or whatever. Maybe, I'm not sure about, that kind of a sale of a house situation. But generally, if you can spread out your income over a number of years, you're reducing that impact. It may not even matter if the number you're talking about doesn't put you, because the brackets are not really bad. You have to have a pretty significant income before you get whacked.
For single people in 2023, it's 97,000,
Right.
and I think it's 197,000 for couples. Is
Yeah,
that
for a
about
couple.
right? Yeah, and then you get added on. So people 97,000 and below have, I think it's going to be 165, the Part B premium.
So just pay
next year.
attention to the grid, because if you're $1 over, you just bought yourself a doubling of premium, possibly.
But always talk to Social Security. It's always worth a call.
Yeah.
Have a puzzle in your lap because you're going to be on hold for a while. But but always, double check it with them to see if there's any way to remedy the situation. But with the one lump sum, that has been an issue.
That's a big problem.
Okay, take this.
I have a question. Since I moved here to Massachusetts, lucky me, I got Mass Health, and it's been fantastic because I've paid 0 premium. So I'm curious what's going to happen next, because I'm 64 now, and can I still somehow get Mass Health as a Medicare recipient?
Well, here's the issue. When you turn 65, it's actually turning 65, not necessarily being Medicare eligible, because people on disability can get Medicare younger than 65. If they're 25 months disabled, they get Medicare. Mass Health supplements Medicare, but you have a new financial criteria to meet. It's lower income, and now they're counting assets. So a lot of people who turn 65 then end up losing their Mass Health, or they get a different, because there's multiple programs under Mass Health. So you might get something, but you'll lose that Mass Health standard, which is the insurance piece, if your assets, if you're single and they're over 2,000, and income is like, the gross income is probably, what, 1,100 or something?
200% of poverty?
I forget.
65. The short answer, I think the answer really is important here. The takeaway is 2 things. One is, there is a constant concern that we have at AARP around the lobbying effort at the state level to recognize that people who are over 65 are being treated unfairly based on what you just said. This is an accident that's occasioned by your age and nothing more, and it's not fair. So we've been lobbying to try to make that change. In addition, there are Medicare savings plans that are available that actually the eligibility has been increased. We lobbied for that as well.
Yeah.
I want to give a shout out to the Mass Senior Action Council. That was their big issue, which AARP joined to fight to make this happen. So again, when you sit down with your council, you go, the Shine Council, go over that kind of detail and know that there are actually ways you can save additional monies to address some of the concerns that you will be dealing with.
Yeah, and just to let people know, right now, we're still technically in a public health emergency. So people who were on Mass Health before COVID hit remain there, regardless of what happened to them financially. So now when you call to make a change, they want you to send in information, but that won't necessarily boot you off Mass Health. And we're kind of waiting, to see when all of this is like, there's going to be this flood of renewals. But I think that's
April?
until April.
Yeah.
It's been approved to April, so.
I have kind of a little quirky two-part question. Years ago when I got my health insurance when I retired, it was fine. I got A and B, and I was very healthy and didn't have any medications or anything. Later on down, I decided I better set myself up for some drug coverage. So I started investigating it, and I now have coverage, but I'm paying a penalty every single month. Yeah. Nobody told me that ahead of time. Had I known it, I would have done something then, but 3 years later, you pay a penalty for each year you don't have drug coverage. Yeah. So every month I have to send I pay a bill for the drug coverage. And first of all, I wanted to know if that's why are they doing that? Why would they charge people just because they didn't get drug coverage right when they turned 65? Why are they penalizing us for not having that? And what are they doing with the money?
Yeah. So you can correct me if I'm wrong, but I think when Part D first came into existence, they had to have people pick up Part D.
Yeah, this was a reverse incentive.
Yeah.
This is more like the stick instead of the carrot.
Yeah.
And it's still around, and it's a problem for B as well, right? Isn't it?
Yeah, B is.
Explain that a little, because that's a bigger number.
Oh God, that's like what?
I'm putting you on the
10%.
I didn't mean to do that.
I can't remember
Just
the
know
figures.
that if you're eligible for A and B and you don't enroll, and there aren't exceptions,
yes,
that there's also penalty associated with that, not just D. I'm not going to weigh into the deepness of that because you're the expert and I'm not.
Yeah, I'd have to have the paperwork, but just to focus on Part D. So the Part D penalty is 1% of the benchmark premium in any given year, which is usually around $32. So we're talking 32 cents times the number of months eligible but not enrolled. So if it's a few years, some plans will disregard it, but others won't. And so you do have that tacked on. And I think for the appeal process, you would have to prove you had what's called creditable coverage, meaning you had equal to or better than Part D coverage, prescription drug coverage. But you'd have to prove that. So a lot of people decided, like we have Health Safety Net, which is funding given by the state of Massachusetts to community health centers. And people said, well, I can go to Cambridge Hospital Pharmacy and get my meds filled under Health Safety Net. And we had to intervene and say, you're accruing this penalty. Right. And there's going to be a reckoning down the road, and you have to jump in on this. And, so unfortunately, that definitely is the case, that there's that penalty.
Yeah. Okay, we've had quite a number of questions looking down here from Zoom on what is medical advantage, and are the plans all pretty much the same? Did we talk enough general about what that option provides as opposed to the other?
Yeah, the devil's in the details with Medicare Advantage plans. I would encourage you to look at the consumer ratings because people can promise you anything, and there are a lot of wonderful, commercials out there showing all sorts of great things. And I told Mary the other day, and please don't take United Healthcare, there are commercials where people are running in the sand, but nobody shows that person falling, breaking a hip, and what happens at the ER when they arrive there and get their insurance information. So, your doctors have to be in network. You really do have to get to know the product and to do your own independent research because when you call, it is a salesperson. Not that they're lying to you about their benefits, but the point is for you to want their products, and that's natural. So do your independent research, make sure that your medications are covered, make sure your doctor is in network. Be sure that the hospitals you go to, the rehab centers you'd want to end up in, God forbid you had a stroke and needed to go to a skilled nursing facility, that they are in network. Because once you're in the hospital and you have to go to another place, you got to go to someplace in network. And you don't want, again, at a very hard time in your life, to be faced going to a place you didn't really want to go to and finding out the hard way.
Yeah. If I could just add, Maureen makes some really good points. If you're going to listen to Joe Namath or William Devane or somebody else, or Chase the jogger down the street, I mean, that's your business. They obviously are spending a lot of money trying to get people to do these things. Look, the takeaway, you people have common sense. Not only are they salesmen, but you've got to be armed, just like when you go to the Shine Counselor. Know your own medical situation, right? You know your doctors, you know your prescriptions, you know your medical history, and you can talk to that salesman and say, okay, this is my profile. What's this plan going to do for me that's better than what I've got already? I mean, you just ask the right question. And, they're counting on you, frankly, just like in the commercial, or just viscerally responding in a way which, belies the need to really get to the research. So that's really what you need to do. Just understand. The good news is many of these plans will cover things beyond what obviously the basic Medicare will do. But you can quickly get into a plan that's more costly, and the out-of-network issue, there's a number of things. So it's all about your own personal situation, and use that, because that's your reality, not the sales pitch. And I think you'll be in good stead.
And it's great if they have hearing and dental, but what is that dental? Where can you see a dentist? Great, a man called me the other day. He wanted a very specific hearing aid, and the Blue Cross Blue Shield, whoever their contracted provider is, didn't cover that hearing aid. So again, those are the details. What's your priority this coming year? Because you may not have to get a hearing aid every year, but, so.
And now, thanks to Senator Warren's bill that was adopted by the Congress, the Senate, and, is now law, you get over the counter. There's a lot of good quality hearing aids that are, heretofore not been available, and a lot less costly than the stuff that, go down that hole.
Maureen, when you were describing what you call option 1 and option 2, when you had it up on the screen about Medigap and the Medicare Advantage plan, that obviously Medigap is meant to fill in some of the gaps from Part B. Is among other things that those Part C Advantage plans have, are they also meant to fill in those gaps, like the 20% copay and the deductible in Part A, and maybe the maximums, I think?
It depends, because they usually listed as daily rates, and some of them kind of add up to the deductible, the Part A deductible. Again, you have to look at the details. And we often have like this Medicare A and B chart that I have a lot of charts I can send people if they just want to look at it all sort of set out. So again, it really depends on, what your particular need is. And when people are healthier, they have more of a need for the extra, hearing aid, eyeglasses, gym discount kind of thing. So again, it's about what are your priorities, and I would ask the plan what their daily rates are, what the co-pays are, what do they add up to? I mean, you may not spend the, several days in the hospital, but you should know what the daily rate is.
Yeah, because in the end, it goes back to the original point that Medicare is a great healthcare policy, if you will, but it's still only 80%, and there are still missing pieces that are significant enough that can put you in a bad place financially. And generally speaking, again, I'll speak from my own experience, what I'm paying additional premiums for is essentially filling some of those gaps through a C kind of a arrangement, right, where they're going to help out with some of the copay. They're going to pay more than the 80%. They're going to get that gap. So you're in a much better place in terms of coverage and net cost to you.
Thanks. You mentioned daily rate. I want to make sure I understood what you meant.
Well, they'll usually list it as a daily rate of what you're going to be charged per day in the hospital when you first go in the hospital. And I think they often, you know, it kind of adds up to the deductible,
I'm going to ask a last question that came in because we're in Cambridge. It seemed perfectly apt. Do I need Medicare Advantage? I'm 77, relatively healthy, but have needed occasional surgeries. Thoughts?
Okay.
Yeah, it sounds like a Cambridge question.
Well, I mean, if you are very healthy and you don't have many medications, you know, again, I tell people you can go for a very affordable Part D plan. Because even though Medigap plans fill in some of the gaps of Medicare, they are not a Medicare product. Therefore, they are not subject to open enrollment. So if you had Medicare A and B and a Part D plan and that was fine for you, if surgery's coming up, you could call a company and pick up a Medigap plan. Again, they don't have to accept you as a client. Most of them do, but again, you know, those are the pros and cons. But often people will temporarily pick up a Medigap plan or switch between plan levels if they know a surgery's coming up. Yeah,
That's a very useful bit of information. Well, I hate to tell you, but it's actually the hour is up. But I'm just going to say my thank yous before you leave, if you wouldn't mind. Okay, I hope this was helpful to everybody. And don't forget to take your nice information sheets on the way out, both from us and from AARP. So I'd like to thank Mike Festa from AARP and Maureen Harty from Paine Senior Services for this very helpful presentation, I felt, and giving of their time and knowledge. Also to Cambridge Public Library for graciously allowing us to host it here. So take the handouts, and remember, Cambridge Forum is made possible through the generosity of Herbert and Dorothy Vetter, the Lowell Institute, the Mass Cultural Council, the Cambridge Community Foundation, and you. So feel free, if you want to donate, or just sign up for information at the website, www.cambridgeforum.org, and you'll find a podcast of this program there shortly. And also links to many other past programs and past podcasts. And thank you all so much for joining us today, and to all of you out there on Zoom. See you all again soon. Thank you.
Thanks.